day your surgery is scheduled, there are many administrative details we need to accomplish, and your help is critical. Before you leave home for the hospital on the day of your surgery, take any morning medications that you were instructed to take with only a sip of water. Please arrive at the hospital 2 to 3 hours before your scheduled surgery time and report to ambulatory surgery. It will be important to have your coach or buddy with you at this time to facilitate paperwork and answer any questions on your behalf. After your paperwork is complete, you will be taken to our pre-operation unit, or pre-op. While there, a New York Methodist staff member will prepare you for surgery. You will be changed into a hospital gown and have a name band placed on your wrist that will remain in place during your stay at the hospital. You will then be taken to the pre-op holding area, where a surgeon will mark the operative leg and obtain all necessary consent forms. While you are in the pre-op unit, your anesthesiologist will visit with you and speak to you about your medical history and review what options you have for pain management. It is required that you have either a spinal or general anesthetic administered before your surgery. Please check with your primary care physician or surgeon prior to surgery about which method is best for your particular case. As you await surgery in the pre-op unit, you will first have your anesthesia administered and then given antibiotics within 1 hour before surgery starts. In addition, a catheter will be inserted in your bladder to drain urine during the surgery and immediately after. Once you are brought into our state-of-the-art operating rooms, the length of the surgery varies from between 2 to 3 hours. With you will be a full team of doctors and nurses to assist your surgeon with every aspect of the procedure. Once your surgery is completed, you will be brought to the post-anesthesia care unit known as the PACU, where you will be closely monitored until you are fully awake. While you are recovering from the anesthesia, your surgeon will speak with your family and coach in the surgical waiting area to apprise them of your condition. As you awaken, you can expect the following: oxygen for your nose, a blood pressure cuff on your arm, a pulse oximeter on your finger to monitor the amount of oxygen in your blood, a catheter in your bladder, a catheter in your back or leg for pain, a surgical bandage on your incision. Feel free to request pain or nausea medication if needed from the nurses on duty. Once you have fully recovered from the effects of the anesthesia, you will be taken from the PACU and placed in a hospital room. There, our staff will monitor your vital signs closely, manage your pain, and instruct you on how to use a device called an incentive spirometer, which helps with airflow into your lungs. They will also teach you daily strengthening workouts for your joints and muscles. It is possible that some patients may spend the first night after surgery in the PACU, but in either case, you can expect that overnight you will continue to be given oxygen, be given IV fluids to keep you hydrated, and have a catheter in your bladder to drain urine. All this is normal, and throughout you are kept as comfortable as possible. Joint replacement surgery is a safe procedure, and the outcome of most patients is wonderful. Although the risks for joint replacement surgery are low, there are potential complications associated with any surgery. It is important to understand these risks before you proceed. Potential complications associated with joint replacement include blood clots, infections, stiffness, pneumonia, implant loosening, failure or dislocation, and rarely, damage to adjacent nerves and blood vessels. Finally, over a period of time, a joint replacement can wear out. There are several things that our staff and you can do to prevent any post-surgical complications. The most common occurrence is blood clots. You will be given blood thinners such as Lovenox and Arcumidin. Plus, you will need to wear special boots to promote circulation. You will also need to have your legs exercised as soon as possible post-surgery to discourage blood clots from forming. Our staff will help you with this. Pneumonia is another serious post-surgical complication. Our staff will monitor your breathing and work with you to cough and practice deep breathing exercises. Infection is always a danger for people who have just undergone surgery, but at New York Methodist Hospital, we create an environment that significantly lowers your risks of infections. More minor post-surgical complications can include nausea, constipation, and swelling. Our staff is sensitive to your needs to prevent and treat these uncomfortable conditions and offer medications as needed, including a daily stool softener or laxative and frequent ice therapy to keep swelling to a minimum. You can expect to be in the hospital for, on average, 3 days after surgery. However, even before your discharge, New York Methodist staff will work with you to plan out all the steps in your recovery process. First, our physical therapist will instruct you on transferring, walking with a walker or crutches, strengthening exercises, stair climbing, and review precautions. Then, our occupational therapist will offer you self-care activities and the use of therapeutic equipment. Our team's goal is for you to reach your maximum level of independence before you leave the hospital. But remember, it is essential to the success of your joint replacement surgery for you to participate in your post-surgical therapy and rehabilitation. If you have any personal questions about your recovery, such as diet, sexual activity, and weight issues, you can confide in your New York Methodist therapist. They are trained to answer your every question. Because each patient's recovery is different, your progress and readiness for discharge will be assessed daily, and your case manager and/or social worker will visit you the day after surgery to see how you are doing. Later, they will discuss with you the discharge plan, assist you with insurance questions, and make arrangements for home medical equipment. You can be of help to your case manager by researching rehabilitation programs in advance and choosing one that is covered by your insurance. You will certainly be happy to return home, but there are a few simple rules to follow to ensure the full success of your operation. You must keep your incision clean and dry. Do not shower until the staples are removed, which happens about 14 days after surgery. You can use a waterproof dressing if necessary, but check with your physician. It is ideal if you wait at least 6 weeks before driving a car, but a lot will depend on your driving habits and what type of transmission you use, so again, check with your physician. Air travel presents its own set of challenges after surgery. If you don't have to fly, then wait at least 6 weeks before traveling. When you do fly, you will need an aisle seat and try to exercise legs hourly to promote blood flow. And be aware that your new joint may set off metal detectors at the security checkpoint, so we advise that you travel with hospital paperwork as proof of your surgery to save time and avoid questions from security. It is advisable to wait at least 6 weeks after surgery to visit your dentist. Be sure to inform him or her that you have a joint replacement. It is possible you might need to take antibiotics before your appointment, so check with your dentist or surgeon on this matter. In addition to the various medications and physical therapy you will need to follow after your surgery, there are several important precautions to take. Those people with knee replacements can reduce knee stiffness and speed recovery by avoiding squatting, twisting, and kneeling directly on the new joint. To reduce pain, you can also place a pillow behind the knee for 6 weeks following surgery. Those with hip replacement surgery require special treatment for about 2 to 3 months after surgery. Before getting out of bed each day, pump your ankles by moving your feet and toes up and down about 10 times. Do only those exercises taught you by your therapist and gradually increase the number of sets you do as you get stronger. Following these rules will help reduce your risk of hip dislocations or bone growth into your new joint while healing soft tissue and strengthening muscles. In addition, depending on whether you've had an anterior, front, or posterior, rear hip replacement, there will be special rules to follow in terms of sleep positions, crossing legs, and bending. It is important to check with your physical therapist to review what will be best for you and never attempt an exercise not prescribed by your instructor. We hope that the information in this video has been helpful in preparing you for your surgery. You've made an excellent decision by choosing to have your surgery at New York Methodist Hospital. Our surgeons and staff have the expertise and dedication to make your surgery and your stay with us a positive one. We look forward to answering any other questions you may have.